federal government is slashing funding to the NIH, the National Institutes of Health, and that decision is going to hit every single one of us. The NIH is the largest public funder of medical research in the world. They're the reason we have life-saving vaccines, cancer therapies, and treatments for things like HIV, diabetes, and heart disease. In fact, 99% of all new FDA-approved drugs in the last decade were backed by NIH-funded research. Additionally, every $1 invested in NIH funding generates $2.56 in economic activity, sparking $95 billion in economic activity just last year. But right now, the Trump administration is proposing a 40% cut, or $20 billion, from the NIH budget. Here in Wisconsin, we're already seeing the fallout. Since January, UW-Madison has lost more than $12 million in federal research funding. That includes a major NIH study on teen mental health, tracking how social media affects brain development in over 300 kids across Wisconsin, canceled mid-study. Alzheimer's research here is also under threat. Wisconsin scientists helped create the first FDA-approved blood test to detect the disease early. Our state provided 40% of the data that made it possible. Without NIH support, that work doesn't continue, and the impact isn't just scientific. Research grants pay for jobs, from lab techs to graduate students, building maintenance crews to those ensuring patient safety systems. At UW, capping NIH funds could cost the school $65 million a year. Graduate admissions at UW-Madison have already dropped 25%, a number that reflects just how unstable this system has become. That's what these cuts do. They're stopping life-saving research, they're ending careers, they're derailing students in the middle of their education, forcing some to leave entirely when their funding disappears overnight. And they're losses we can't afford. We don't stay at the forefront of science by accident. We do it by funding it.